I use orgone therapy, use the couch as a tool, like the stethoscope, I use the couch. With little children, this tool is very important. Very little children, you ask the mother to put them on the couch, and they show you a central feeling which is very touching and very moving, and it is trust. They trust you and they are curious at you. They touch you, they look at you. I tell you, it's very moving. Disturbed children don't do that. Disturbed children don't want to go to the couch, fight against it, yell against it, and little Mario made his temper as soon as his mother wanted to put him on the couch.
Welcome to the A Different Kind of Psychiatry podcast, brought to you by the ACO. I'm Dr. Chris Burritt. Each month, we feature a case presentation, interview, or discussion by one or more of our doctors who practice a different kind of psychiatry. We are interested in your questions and comments, and I would love to hear your feedback. Send an email to aco@orgonomy.org. The best way to help the ACO spread its knowledge is by letting others know about us. We'd love for you to leave a rating and review about what you enjoy about the podcast, and you can do so either through Apple Podcasts, iTunes, or on Amazon's Audible. This helps others know why they may want to listen too. If you're interested in attending one of our webinar presentations, you can meet the doctors and join in on the discussion afterwards. You can connect with us and learn more at orgonomy.org or adifferentkindofpsychiatry.com. This episode features the audio from one of our recent webinar presentations. Dr. Alberto Foglia discusses the care of his patient Mario, who is a hyperactive, aggressive, and angry 3-year-old boy who terrorized other children in his preschool. Listen to hear how Dr. Foglia helps Mario and his mother and demonstrates the importance of setting boundaries and asserting natural parental authority when raising children. Today's presentation is brought to you by Dr. Alberto Foglia. His presentation is entitled Treating the Effects of Permissive Parenting. Dr. Alberto Foglia is board certified in psychiatry by the Swiss Board of Psychiatry and in medical orgonomy by the American College of Orgonomy. Dr. Foglia has a medical orgone therapy practice in Lugano, Switzerland, where he treats infants, children, and adults. Dr. Foglia, welcome.
Thank you, Dr. Burritt. Thank you to everybody. I'm glad to be here, and I hope to satisfy your interest and curiosity. I want to present this case because it is a very interesting case. It is a 3-year-old child with severe behavioral disturbances due to exaggerated permissiveness. Little Mario. And I want to show how medical orgone therapy is effective as a therapy of emotion, sensation, and instincts rather than words with such a little child.
So maybe just start off by saying what had his mother bring him to treatment with you? What was the problem?
First, the mother was already a patient of mine, so it was easy for her to ask for my help. Her son was aggressive, was unbearable, he was hyperactive, he moved around, and the mother received many calls from the teachers at kindergarten because he was harassing the other children and even beating them. So it was a severe disturbance of his behavior.
Did this occur suddenly, or had this been going on at home too?
It was developing slowly, progressing slowly, until the teachers really had enough and really asked the mother to do something. And that's when she decided to bring him.
I see.
And when I saw him, I was myself shocked. His behavior was really very bad. He was aggressive. He didn't want to separate from his mother. He didn't want to go to the couch where I wanted to examine him. And it reminded me to research made in the 70s, 80s by Jane Goodall on chimpanzee. There was a little story of the mother Flo old chimpanzee that was unable to win her little child, Flint. Winning for chimpanzee means taking them off their shoulders. Flint didn't want. The mother tried to bring him down, but she was weak because of old age. And he made a huge temper. And I want to show you this video, and you will hear the voice of Jane Goodall herself.
When denied his way, Flint threw violent temper tantrums, even hitting and biting his mother.
Perhaps because she was too old to cope, Flo often gave in and let Flint have his way. Later, this would have grave consequences.
She looked afraid of him.
She's weak. You see two equivalents between the chimpanzee and my humans. The child behaves in the same way little Mario did on the couch, the same temper as Flint. Even worse, in one occasion, he made like he had a gun and pointed to the face of her mother, something I've never seen in a child like that, so small like that. And the equivalent of the mother, my patient mother, was also weak, not because of the age, but because of her neurosis. And she was also scared of her son. She was unable to limit him.
Can you describe how therapy began then with little Mario?
I use orgone therapy, use the couch as a tool, like the stethoscope. I use the couch. With little children, this tool is very important. Very little children, you ask the mother to put them on the couch, and they show you a central feeling which is very touching and very moving, and it is trust. They trust you and they are curious at you. They touch you, they look at you. I tell you, it's very moving. Disturbed children don't do that. Disturbed children don't want to go to the couch, fight against it, yell against it. And little Mario made his temper as soon as his mother wanted to put him on the couch.
Mm-hmm. What does Mario look like, if you could describe him a little bit?
He's a little tough, kind of boy. But once he came into my office, he began to yell and cry. You could see he was half terrified and half aggressive. This is a so-called attachment problem. Distancing from his mother with a friend, with an unknown adult, is for him an enormous moment of anxiety. And he fight against that.
I see, which makes sense why then the problems would start coming out in school even more than at home.
Exactly. So in the room and in the couch, you see, like in the adults, a concentration of his neurosis. You could see everything, him and his mother neurosis.
I see.
And doing that, looking at him discharging all this rage and fear, and the mother learning slowly to bring him on the couch, just to do what she said, was therapeutic for him. In 4 sessions, he was, I could say, cured by his hyperactivity.
Maybe you could say something. While the mother was putting Mario on the couch, what did you do? How did you help them with that process?
That's interesting, because in this process which I call a battle, little Mario didn't look at me at all. I was inexistent, and I didn't fall in the trap of being the bad guys that take him and put him on the couch, and the mother doesn't learn to be assertive with him. So I just told her mother every 5 minutes, I'm expecting you to bring him on the couch if you want him, if you want me to examine him and to treat him.
Dr. Foglia, that's interesting that you say that. It wasn't that this is what has to be done, but this is how I do things. And if this is something that's important to you, this is what we do.
Exactly. And the mother learned with me to do some things she will do at home. She has to be assertive with him, even if I'm not absent. The father had the same problem. He wanted to help his wife and intervened, and he was a bad guy. And that was not good. It brought to nothing.
So dad was coming to the rescue.
Exactly. To the rescue that was not productive for the education of little Mario. It was the opposite, because he called his mother. The mother was not able to be assertive, so only the father was assertive, and this was not good. The mother had to learn to change her behavior with her son.
So if I'm hearing you correctly, so for these first 4 sessions, you were sitting there almost non-existing in the process, except when mother looks over to you saying, "What do I do?" And you say, "I'm expecting you to."
And sometimes telling to little Mario, I want you to lie down. And he didn't look at me. I was nothing.
So you were observing and a fly on the wall as mother and child work things out between the two of them.
Exactly. And every session, little Mario went home and he made an improvement. He was better and better after every session. At the 4th session, he began with his temper like usual. And at the end, he accepted to look at me and to do what I wanted him to do. And at that moment, he became my patient.
That's wonderful to hear. So you were working with mother for those first 4 appointments and sessions, and then Mario said, "Okay, here I am."
Exactly. And at the 5th session, Mario stayed in the therapy room with me alone without his mother.
Wow.
And from then on, he began therapy like other children with less severe disturbances.
And did the mother hear from school about how things were during that period of time?
Oh, yes. She had a feedback from school that Mario was much better than before. Yes.
Wow. And so you're saying he was very hyperactive, and that hyperactivity was basically given up after those 4 sessions.
Exactly. And this is very interesting about the discussion about the famous, now very famous syndrome, ADHD, attention deficit and hyperactivity disorder. This is a modern psychiatry diagnosis. We don't agree about that. For us, ADHD is a symptom. It is not a diagnosis. You can have, like little Mario, a severe ADHD, but the real character diagnosis is not that severe. Impulsivity is not his primary symptom. So that's why he was cured in only 4 sessions. There are other children where impulsivity is the primary impulse, sick impulse. And then you will need much more than 4 sessions to do something.
The hyperactivity didn't run as deep.
Exactly.
I see.
This was a behavioral educational problem. Other children is a deeper problem. This was exactly like Flo and Flint. It was an attachment problem.
Yeah. So was the mother still in therapy as her son was also coming to therapy?
Yes, and that was decisive. Without that, I don't think we could have that success.
Could you describe that process a little bit, how your therapy with her changed or was modified as you were beginning to work with her son?
I don't think that unfortunately, I cannot show you the video. I don't have the permission to show you the video, but I don't think that a mother who is not in therapy could stand to see her son making that temper in a medical office. She would think that he is upset by me, that he is upset by the therapy, and that this is not the problem of the son. So I don't think it would be possible for a mother without therapy to understand what is going on.
I want to make sure I understand that correctly. You're saying that if he were to have that tantrum and she didn't have her own experience with therapy, she would see that as just coming from that process of being with you in the therapy office, not being something central to their relationship?
Yes, most probably yes, unfortunately. And that's why I don't treat children if the mother is not already in therapy with me.
I see.
Yeah. The child is an extension of his mother. And if I treat the child, it's like treating the mother, and vice versa too. So it's not good. I had many bad experiences with mother who were not in therapy.
I see. Yeah. With my own patients, I've seen a difference, like you're describing, is if I'm treating one of their parents or both, and working with the kid, it lends itself to being a simpler process.
Yeah.
Because there's so much education and having a feel for the depth and the intensity of the emotions that come up in working with a child.
Yes. If they are not used to their intensity and hidden emotions, they cannot grasp what's going on with their children on the couch.
Mm. And then how did therapy progress after he became a patient of yours?
Then it progressed like with many children, very boring, completely different. Children who has some symptoms, but no longer social symptoms like he had, can be very bored in therapy. So usually if they don't have much problem, therapy is only 20 minutes, making contact with me, looking how they react, and that's it. And that's it. Making contact is very important with children.
You say that's it, but it actually sounds quite important.
Yes, it is important. And it's very satisfying treating children, very. You can have great change in few sessions.
Yeah. Well,
like in Little Mario case.
Yeah. Yeah. So what were his difficulties after that initial attachment problem was addressed?
What was addressed in his therapy?
Yes.
His contactlessness. That was boring because he was contactless. That is, he didn't feel and he was not in contact with his deeper feelings.
I see.
So he was already pretty armored for a little child like that. So he was bored. And you need many sessions because you cannot be too intensive, you cannot intervene too strongly with the child. You have to be.
You're saying you don't push them. You don't push them to have contact, to make contact.
Yes.
So his subjective experience of his lack of contact was a feeling of boredom. Is that accurate?
Exactly.
I see.
And this is much easier to approach with older children, this boredom. When they are 11, 12, so they lie down, they got bored, but they learn slowly to feel this boredom as the superficial layer of many symptoms that are completely hidden. And this is usually a wonderful experience. To see slowly, session by session, these feelings comes up. I always say boredom is like the crust of the volcano. If you sit on it, you accept the boredom, sooner or later you will feel the heat coming up.
I love that.
Yeah, that's boredom.
Yeah. So the challenge that makes me think of is just helping teenagers or young children to even get to the point where they're feeling bored, because there's so many distractions these days. They can't even get to that crust that you're describing.
Yes. Unfortunately, yes. We live in a very overexpanded, overexcited society. And this is a big problem. Yeah.
I see.
We live in a permissive society. Little Mario was the product of exaggerated permissiveness, which is part of this overexcitation. Everything is good. You may do whatever you want, etc., etc.
And there's a question from the audience.
Yep.
What is the role of the father in therapy? Should he be in treatment too? How do you address that?
That's a good question. I think the mother, because of her biological function, is more important. The father is, like you see in animals, he protects the couple. He's around them and he protects the couple so that they can develop harmoniously. So if only the father in therapy is not that good as only the mother. If he wants to do therapy, then it's wonderful. Then you have two parents that know what's going on.
In Mario's case?
In Mario's case, the poor father was like me. He was nothing. He was not even looked at. And if he wanted to do something, it was worse. Because mother and son were so involved in their symbiosis that everybody else was not important. So the father could do only wrong. And I had to teach him also to not fall in the trap.
You had him come to the office?
Yes.
I see.
Not fall in the trap. Don't try to help your wife. Would be worse.
So it wasn't that he had his own therapy, but education as looking at the effect that he was having on the relationship.
Yes. So it was half and half. A medical orgone therapy for little Mario and social orgone intervention, social orgone therapy for mother and also the father.
I see. And you're touching on the biological role of fathers, and I know that, has to be identified. It's not something you label, but it makes sense what you're saying, that like the father protects the mother-child relationship from external forces that may interfere.
So he has more social function compared to the mother.
Yeah.
Who has a more psychic, biological function.
Another question from the audience member is, could you say something about the mother's difficulty? How did that contribute to her role in Mario?
This is a sad part of the story. Her permissiveness comes from severe abuses she had as a child. She grew up sexually abused by a family member. So she grew up confused, weak, submitted, chaotic. She came to me in a really bad shape. She was much better when she got pregnant after several years of therapy, but unfortunately not enough to be able to see when her child became also abusive. She submitted again, this time to him.
That was a deep attitude in her to submit to any kind of aggression against her.
Unfortunately, yes. This was a problem. That's why she was so exaggeratedly permissive. That was her weakness compared to the weakness of Flo, which was more natural, old age.
I see. So you're touching on the psychological versus biological. We're looking at animals interacting, and there's the same phenomena as you're experiencing with human interaction. How do you see that?
I see that, thanks to medical orgone therapy, that today we give too much importance to the cognitive, to the consciousness, to the psychological. But neurosis, already shown by Freud and more so by Reich, are rooted in the biology of human being, in the instinct, in the emotions, in the sensation, in the autonomous nervous system rather than in the brain. And you can see that in chimpanzees, which are not that developed centrally and show exactly the same disturbances in this case as human.
I see.
Yeah.
Another question that came in was, do you see any other factors contributing to Mario's armoring and difficulty aside from his mother? Was there any other factors that were involved?
I think that a factor in little Mario is also his nature. This is his healthy side. He is for sure, like his father, strong. He is energetically a strong child. I think that if he would have been less strong, his mother would have had less problem with him. This strength, which is natural, was surely one of the factors that made this neurosis between him and his mother.
So you're talking about the mismatch of the nature of Mario and how that that related with his mother and her nature and her character combination. And I like that you highlight that, because sometimes that can just be a spontaneous process that two natures, clash.
Yeah, but there is also a nature and a neurosis.
Yeah.
I see many high energetic children. I want to say something before. I see the child rearing like a brook that comes from the mountains and grows up and become a strong river and goes to the ocean. For us, it's the same, becoming from a small little thing to a strong, independent individual, going into happiness in love, work, and knowledge. This is the ocean. But you have a nature, a different nature. You have strong brooks and small brooks, weak brooks, and high energetic brooks. And high energetic brooks are more in danger than weak brooks. A slight neurosis of the parents, a slight intervention from the society can change a lot. Trauma in very early childhood and high energy can be a very dangerous connection. Very dangerous.
Dr. Foglia, that makes me think of, aside from my private practice, I've worked in corrections and jails and prisons. And there you can get a sense of just this wonderful high energy, this nature, and it could be aggressive, it could be reaching out, trying to make connections. And when that gets thwarted, it becomes horrible,
Yes.
Yeah.
And you go you say nursery in America where all the children are, little born children are, you can see the difference between the different children. There are the low that sleep all the time, and there are the big, very strong little children. If something happened to them, then you have big problems. And it's very, very easy to disturb that trustfulness that you see in little children. This is a real danger. This trustfulness makes them very, very easy to be disturbed.
Maybe you could say more about that. You're saying when you see a young child who's lively and healthy, there's just this natural, spontaneous connection you have with them, and there's this trust. How does that become disturbed so early?
Any disturbance of contact disturbs the capacity of contact of the little child. So a mother who is contactless, completely contactless, say with her invasivity, you say in English, tendency to invade others.
To insert themselves into other people's lives.
Intervene and be aggressive and pushy without knowing.
She
takes her child like that. I love you. And for the little child, this is not love. This is an aggression. This is enough to ruin the capacity of contact of the little child. But even a smoother, lighter intervention can disturb the contact. It is a very, very fine equilibrium. So it's very easy to neurotize a child. Very easy.
Yeah.
Unfortunately.
Yeah. There's a question from one of the audience members going back to the father. Did he get that easily, that your suggestion to you can only cause harm, to just stay out of it? Did that just come naturally? He said, okay, or was there trouble? And
he was happy because finally he understood all his problems with his wife and his son. I try to help my wife, and every time it's worse than if I did nothing. But I tried every day, and it was a mess. So when I explained it to him that it was for no help, because the problem was a mother, so he was happy, he was released. And so
it sounded like you confirmed with him something he already felt but didn't know what to do with it. Yeah,
exactly. So he pulled back and he was happy.
And maybe we're talking about permissiveness a lot, and this just came in my mind. How do you help a parent know if they're being permissive? How do you help them see a behavior as permissive or not? I think there's a lot more confusion in parenting than ever before. It used to be much more clear, this is how things were.
It was clear because it was authoritarian. Now it is no longer clear because it is permissive. But in reality, it is a dichotomy, when to be authoritarian and when to be permissive. We went from a poison of the past, authoritarianism, to today's poison, permissiveness. You cannot understand this problem without the fundamental distinction Reich did between primary and secondary impulses. If you see this difference, primary impulses are healthy from the core, they are clean, they are open, you feel them as something wonderful in little children and also in animals, and secondary, hypocrite, uneasy, disturbing, fake. A good example of a secondary emotion is whining instead of crying. Whining is not crying, is not clear, is not direct, it's indirect. So when you make this distinction, and you make this distinction with the guts, you don't make it with the mind, then it's easy. In the past, people were authoritarian against every impulse. Everything was smashed down. Today, we are permissive with everything. And this is not right. You got to be permissive with primary healthy emotions. You got to be authoritarian with secondary destructive emotion. The mother of little Mario learned to be authoritarian with the destructive impulses of her son. But that doesn't mean that she will be authoritarian against his primary emotions, which are still there.
There's another question about how do you distinguish and how do you figure out what's permissive. But what I'm hearing from the audience is there's great difficulty in having a sense for that.
It's not easy. It's not easy. I cannot give you a recipe to that. But just knowing that there is this fundamental distinction, you will learn in years. You cannot learn today how to distinguish between a primary and a secondary emotion. You need practice on that. Looking, observing children, youngsters, even adults. We, as ergonomists, we are used to see that in our patients, and we are used to perceive the difference. Reich described in character analysis everything which is secondary is disturbing. But this is disturbing when you are used to that and you are pretty in contact with your emotion. You can be contactless against that. You cannot distinguish between a real crying and a secondary crying. It's not that easy. The question is very, very, very difficult to answer.
Yeah, and the parent can be out of it or out of contact and just know that there's some emotion being displayed and they're having difficulty in figuring that out. But I like what you said, which is that it takes time and you can't just read a book about it, and this is what you stop, this is what you allow to come forward. And what I'd add, having a 2.5 and a 3.5-year-old, is it also changes. As soon as you think what to do to help raise a child, it changes, a week later, a month later. Yes. And I think that's important to keep in mind too, is that it's life. It's always moving.
So in my metaphor of the brook that becomes a river, I say it is exactly early when it is still a brook that it tends to divert every 5 minutes. You solve a problem, and the day after you have another, completely new. I had a girl who came to therapy because she began to be obsessive and clean her hands in an exaggerated way. In one session, she got out her rage, and this disappeared completely. 3 days after that, she began to have another problem. She began to whine, and then you had to begin with the whining. So they tend always to divert the path to the ocean, unfortunately.
Yes, and so you have to be aware and observing of what's going on, and especially, it's not just children who are more distracted than ever, it's parents too. And so the more distracted they are, the less they can be aware of what's happening and have the time to observe.
But this tells you how the role of parents, school, society is important in helping little brooks to go to the oceans. It's not easy. They don't go alone. In the 60s, 70s, in the revolutionary years, we all thought that just letting a child grow up like an animal, it would be fine. It is not like that. It's very difficult for them to follow the path to the ocean. So the role of parents is decisive. But
that was the beginning, you're saying, of that permissiveness of saying, we're too repressive, we're too restrictive, we just have to stand back and let things develop as if that was all that it took for raising a child.
And we went from a disease to another disease. Yeah.
I like the way you described it. That's beautiful.
Yeah.
So, Dr. Foglia, maybe you could just underscore, what was it that allowed you to help Mario so well and so rapidly?
First, medical orgone therapy. It is a therapy about emotions, sensation, and instincts. You cannot approach a 3-year child with words. If you use words, you can educate her mother, that's it. But it was not enough to educate her mother. Little Mario needed to discharge his temper in treatment room and not at home. This was therapeutic for him, as it was therapeutic for the mother to learn to be authoritarian against his secondary emotion. But medical orgone therapy and this instinctual approach was decisive.
Well said. And I'm curious, do you know how Mario's doing now? How old is he?
He's no longer my patient. He's now, I think, 12. I know from people who knows him that he's doing well, that he never was hyperactive again. He was well until now. So
that's great to hear.
Yes. It happens often that I don't see them in the boredom phase. So they don't want to come anymore. Many of them don't come. And then they are, say, 14, 15-year-old, and they have a problem. And they ask a parent, why do you don't bring me to Dr. Foglia that I want to discuss with him that and that problems. That happens. And it's very, very interesting.
Huh. So basically, if I'm hearing you correctly, you leave the door open. If something comes up,
yes,
they can return. I like that too, because you're not telling them what they need or what they should do, but allowing them to come to you if they need it.
Yes.
I think even that is allowing them to figure things out and giving them the independence to deal with their own problems,
Yes, and they remember what they did. For example, they can get rage out in therapy, and they come to an age where emotion comes up very, very strong. They need to cry, they need to rage out. And so they remember what they did with me as little children, and now they want to do it again. Dr. Foglia, I need to discharge my rage.
Yeah. A question came in from the audience, about just would traditional psychiatrists prescribe Ritalin or some other drug to fix Mario's problems?
That's
in Switzerland, is it the same as America where that's common?
Yes, it's common. It's more common than in the past because of permissive education. And the problem is also modern psychiatry that doesn't make distinction of diagnosis. It takes ADHD as a diagnosis, and they don't have much other than medication. And we are beginning in Switzerland to do like in America, to treat children with medication.
The symptoms.
Little Mario would have received Ritalin in any case. No doubts about that. Yeah. This is a sad story for psychiatry.
I would add that it's not that medicines are good or bad, but if you ignore the underlying emotional aspect of the functional picture of what's happening, that's the error. It's not so much that medicines are good or bad, but...
Exactly. I think that there are children with severe character neurosis and ADHD. After many sessions, you could begin with Ritalin. You can do nothing else because there are children that are really very severe.
Yeah, I agree. I've seen that too.
Little Mario was severe, but the diagnosis, fortunately for him, was not that deep. So it was worthy trying.
Yeah. Dr. Foglia, before we finish up today, what would you like to leave the audience with? This has been a wonderful discussion of Mario and the broader aspects of medical orgone therapy. How would you like to end things?
I would like to end in confirming that there is not a bad permissiveness and a good authoritarianism, a good permissiveness, or a bad authoritarianism. It is always a problem of contact. And for me, the distinction that Reich made between primary and secondary emotion is really very, very important, not only in child rearing, but it is important also in our social life for adults. So this distinction, primary and secondary emotion.
Thank you, Dr. Foglia.
You're welcome. You're welcome.
How do you feel after listening to this case? What do you think? Dr. Foglia is spot on with his observation of the problem of permissiveness in today's parenting and the overall attitude in handling children in school and society, whether in Europe or the United States. I know Mario and his mother are fortunate to have had therapy with him. The problem is great, but the good news is that by identifying primary and secondary emotions and expression, we can all be clear on what to do, and not just in raising children. It hits at the core of the human problem. What do we support and encourage at home and in our society? And what do we limit and rationally fight against? We are interested in your questions and comments, and I would love to hear your feedback. Send an email to aco@orgonomy.org. Stay tuned for our next episode, and we'd love to have you join us for one of our webinars. The best way to help the ACO spread its knowledge is by letting others know about us. I hope you'll share this podcast with your friends and family and let them know about our work. You can connect with us at orgonomy.org or adifferentkindofpsychiatry.com. I'm Dr. Chris Burritt. Thank you for listening to the A Different Kind of Psychiatry podcast with the ACO. Since 1968, the psychiatrists affiliated with the American College of Orgonomy have been helping patients discover greater satisfaction, health, and overall well-being in their lives, whether patients suffer with mental illness, struggle with addiction, or feel unsatisfied with their work lives or relationships. medical orgone therapy as practiced by the physicians at the ACO offers a way forward, often without the use of medication.